Hello, everyone, and welcome to the ASCCT webinar. This is Christy Sullivan, your secretary. We are very happy to welcome Dr. Russell Thomas from the Hamner Institutes for Health Sciences. Dr. Thomas is the director of the Institute for Chemical Safety Sciences and the Center for Genomic Biology. And we're very pleased to have him talking to us today. So first, a little bit of housekeeping. As you just heard, the webinar is recorded, and we will have a link sent out to members after the presentation in order to view the webinar if you want to. Also, I'm going to mute everyone's line to cut down on background noise, and after the presentation, I will unmute in order to allow you to ask questions. And finally, I wanted to remind you all of our annual meeting. It's going to be on September 21st at NIH. And we are still accepting poster abstracts, so if you wanted to attend and you missed the deadline, go ahead and send that in. And the early bird registration rate ends on September 1st. We have the agenda is now online, and so you can see the talks that we will be having. We'll have a poster session, the business meeting for members, including the election of new board members, and the social reception. So I hope you will all be able to join us. So I'm going to go ahead and mute everyone. Okay, and Dr. Thomas, I just unmuted you. So,
okay, can you hear me?
Yep.
Okay.
All right, go ahead and get started.
All right, let me hold on a second. Looks like I'm got control. Thank you for inviting me. Christy asked me to give you a little bit of a talk on how some of the research we've done here at the Hamner on incorporating some of these newer technologies into tox testing and risk assessment, in particular more of the high throughput screening as well as some of the more genomic-based technologies, and how to make better decisions on chemicals in sort of a tox testing-based framework. So that's what I'm going to be telling you about today. So I guess one of the driving forces behind forming this organization, I believe, and was really a lot of, as well as many other groups, as well as workshops and other meetings around the newer technologies into tox testing, was the release of the 2007 NRC testing report, Tox Testing in the 21st Century. And I kind of put this cartoon up there to really, even though it's tongue-in-cheek, it really was a precipitating moment in toxicology, and really got the discussion around what role many of these new technologies, as well as where we're going as a community in terms of the future of toxicity testing. And we've continued to this day to discuss, what we're going to be as a science and a community going forward, and what is the best way to apply many of these technologies to make better decisions on chemicals. And it seemed like even after the release of the NRC report, a lot of other groups also had visions on how toxicity testing should be done. And this includes, like the next-gen risk assessment effort by the EPA, the Human Toxicology Project Consortium, Tox21, and the ToxCast Project, Risk21, the Center for Alternative Animal Testing, and everybody has a slightly different version of how this vision should unfold in the toxicity testing. But one thing I want to point out is that in many cases, although some of these visions have taken larger steps than others in trying to collect data to support what the vision that they are proposing, but in many cases, this initial vision that was released by that was essentially based by the toxicology community was just that. It's more of a vision. And so what I want to do today is talk about what we can do to transition that vision from that vision that was how to incorporate these technologies into toxicity testing into more reality. And this cartoon I found on the web kind of illustrates that, in that we all see all the advertisements on commercials regarding what our Big Mac and our Whopper is supposed to look like when we go to Burger King or McDonald's. But when we actually go to Burger King and McDonald's, we actually get served something that actually looks much different from that advertisement. And so essentially, part of what I'm going to talk today about is essentially, even though we have these visions laid out for what toxicity testing in the 21st century should look like, what does, when we apply when we start analyzing the data and we start using some of these technologies to make better decisions on chemicals, what does the reality actually look like? How can we apply them? Are they really useful for making decisions on chemicals, and how can they be useful on making better decisions on chemicals? And so that's the main thesis for what I'm going to be telling you about today. And in particular, keeping with toxicity testing and risk assessment, I'm going to try to evaluate these technologies in the classic pieces of a risk assessment framework. That would be hazard, dose response assessment, and exposure, because all these elements are going to be necessary to make better decisions on chemicals. And in particular, I'm going to be telling you about how some of these newer technologies, in particular in vitro assays, can they be used to make better decisions on how we assess chemicals for hazard? Can they be used to make better decisions in dose response assessment? And with that, it's not just going to be in vitro assays, but also short-term in vivo genomic studies, and then also folding in the exposure component as well. So let's take the hazard part of the discussion first. And essentially, this effort is formed around some efforts to reanalyze and and look at the data that's been generated by ToxCast. As we all know, ToxCast is one of the efforts ongoing to try to apply in vitro high-throughput testing and high-throughput screening to try to evaluate many chemicals for potential toxicity, and they've actually collected a relatively large amount of data and dumped it in the public domain. The initial concept for ToxCast was, at least in terms of the phase 1 concept of ToxCast, was to take about 309 phase 1 chemicals, primarily pesticides and high production volume chemicals, put it through in vitro high-throughput testing screens, and approximately 600 of these. I know it says about 200 to 300 biochemical assays. It's all depending on what you call exactly a screen. But approximately 200 of these are cellular assays, and approximately 3 of them are cell-free biochemical assays. And they evaluated the activity of these chemicals based on the concentration of the well. And the thought was, at least initially, that there'd be predictive combinations of these assays that would eventually be able to predict in vivo hazard and prioritize these chemicals for additional screening. Although it's kind of not coming through with very good resolution, here are some screenshots of some of the work we're trying to develop these signatures that have been published so far. There was one published by Matt Martin on trying to develop a reproductive toxicity signature. This effort showed approximately about a 74% balance accuracy, but I'll point out a few things, in that he pre-filtered his assays and lumped various assays into 6 classes based on genes and functional groupings of these assays. There was also some effort by Richard Judson to develop a rat liver tumor signature, and by the Sipes et al. Publication to try to develop a developmental toxicity signature. And in that study, she also filtered her assays and aggregated them based on gene and gene ontology categories to develop her predictive signature, which resulted in about a 71% accuracy. So what we did, instead of trying to focus on trying to develop a signature and trying to evaluate whether these in vitro assays can predict in vivo hazard in a very focused way, we did try to take a very comprehensive approach to try to evaluate how useful these assays were for predicting in vivo hazard. And to do that, we partnered with the SAS software company. They're the big statistical analysis software company, and we did this in a couple different ways that different from what had been done previously. First, what we did is we tried to benchmark how well these in vitro high-throughput screening assays performed compared with regular old chemical structure descriptors. So how well they did relative to QSAR methods, because we believed that if these in vitro high-throughput screening assays were ultimately going to be useful, they had to be better and give you more information than regular chemical structure descriptors. We then take that both the chemical structure descriptors and in vitro high-throughput screening assays, developed these statistical models with SAS, and used what's called cross-validation to evaluate their ability to predict an in vivo endpoint. And cross-validation, the way it's typically performed is you take your data set, your high-throughput screens, as well as your the associated in vivo endpoints for those 309 chemicals. You break them up into 5 equal sets. You set one set aside, and then you use the other 4 partitions to select your features. In other words, select the in vitro assays which are the most predictive. You use those selected features from the 4 partitions that you're using to build your model, and then you try to predict the holdout set using those in vitro assays. And then you set another set aside, and you predict, and you select your features, build your model, and predict your holdout set again. And you do that until you've left out each one of the 5 holdout sets. And then you jumble them all up again, and you repeat that whole process 10 times. And with that, you develop an overall sense of the accuracy, sensitivity, specificity, your ability to predict negative, predict positive chemicals, and other performance metrics called AUC and root mean squared error. We'll get into what those actually mean. But essentially, through this process of always leaving a set out, building your model with the 4 partitions that weren't left out, you begin to develop an assessment of how well you're able to predict in vivo endpoints using the in vitro high-throughput screening data. And this is called cross-validation. Another thing that we did that was different was instead of just using one statistical classification model, we decided that we wanted to be more comprehensive than that. And so we actually employed 84 different statistical classification models that used 8 different classification algorithms coupled with approximately 12 different feature selection approaches. And with the combination of those two, we got approximately 84 different classification model and feature selection combinations. And this allows us to more broadly assess the predictive performance of the in vitro high-throughput screening data, as well as the chemical structure descriptors for each in vivo endpoint. And when I show the results of this analysis later, these performances are going to be shown as box plots, which is essentially the range and central tendency of the ability of these in vitro high-throughput screens and structure descriptors to predict each in vivo endpoint. In addition, we covered also more comprehensively, instead of just focusing on rat reproductive performance as well or developmental toxicity, we took 60 in vivo endpoints that have been already curated in the ToxRef database. And this allowed us to also do a broad-based evaluation of how well these in vitro assays predict in vivo performance. All right, so just a quick 1 or 2 slide background on statistics. So all of these in vivo animal responses were not were converted into a discrete yes/no answer. So in other words, does this chemical cause a particular in vivo effect or it does not. And these are essentially broken into positive and negative in vivo responses. And the prediction of these statistical classification algorithms are also broken into a discrete call based on a positive or negative response based on the outcomes in your in vitro assays or what chemical structure descriptors are actually present for those chemicals. And so essentially what you're trying to do is build a model that correctly predicts your in vivo animal response. In that case, your ability to have a positive prediction and well as a in vivo animal response that's also positive is called a true positive. You can also have false positive when you when you predict a chemical as positive but it's actually negative in an in vivo animal response, and you see all four parts of that data matrix. So essentially what you're measuring then is your ability to correctly identify the chemicals that are positive. Essentially true positives is a measure of sensitivity, and your ability to identify true negatives is a measure of your specificity. In addition, there's another classification performance statistics called AUC, and the attractive part of this AUC metric is its ability to combine both sensitivity and specificity. So, and essentially it's what's called the area under the curve of the receiver operating characteristics curve. And this was developed back around, I think, in World War II to assess how well radar did at identifying incoming planes when they were trying to build radar facilities for identifying signatures for aircraft. And essentially, an AUC of 1 is a perfect. You have 100% sensitivity as well as 100% specificity. Your ability to an AUC of 0.5 is essentially like flipping a coin. And so essentially an AUC above 0.5, between 0.5 and 1, is essentially predictive. All right? So with these endpoints that we're evaluating, these are the endpoints that these 60 endpoints are on the x-axis here, and these are the ones that we pulled from the ToxRest database. And these were selected because these have at least a reasonable prevalence of positive chemicals among the endpoints that were present in ToxCast. Ideally, you would have a balanced selection of chemicals that are essentially have half or endpoints that have 50% positive chemicals or 50% negative chemicals, and those are identified in the tan box. And essentially there's only about 5 or 6 of these endpoints that really have a balance of positive and negative chemicals. You can see that you have a number of endpoints that have more chemicals that are positive than negative chemicals, as well as a large number of endpoints where you have fewer positive chemicals and a vast majority of negative chemicals. The reason you want to have a balance of negative and positive chemicals is you want to, when you develop these statistical models, you want to be able to not necessarily overtrain your models for identifying positive chemicals versus negative chemicals. So ideally you have a balance, but in this particular case we're limited to what we have. I will point out that many of these endpoints and the annotation of these endpoints follows a specific pattern. A D here is for developmental toxicity, followed by the species, followed by the increasing resolution of what these endpoints actually are. In this case, it's developmental rat maternal. In this case, it's developmental rabbit maternal, general maternal, and a systemic toxicity. So you can see we cover a broad range of endpoints. You have chronic studies, you have multi-generational studies, and these cover everything from specific organ toxicity, such as kidney toxicity, to reproductive outcomes, liver hypertrophy, cholinesterase inhibition, so on and so forth. So there's a broad range of toxic endpoints as well. So getting into some of the data, this is the graphs of the AUC of the ROC curve for the prediction of in vitro assays, and the top set of graphs are the performance of the in vitro assays, and the bottom graph is essentially the performance of chemical structure. On the x-axis again is the endpoints, the in vivo endpoints that are trying to be predictive. And I will point out that the order of these in vivo endpoints is in the same order of prevalence as we saw previously. As we pointed out, AUC of 0.5 is not predictive, and so what we're trying to see is a box plot here that is considerably above 0.5. And you can see for the in vitro assays, the majority of the AUC values across all the different statistical classification models, and remember there was about 80 different statistical classification models, and that's covered by the box plot. And so our ability to predict, let's say, the rat maternal toxicity is not very far over what would be considered random chance. And our ability to predict, our greatest ability to predict an in vivo response is for rat cholinesterase inhibition. All right, and see most of the values are between 0.6 and 0.5. And that's true also for chemical structure, although for chemical structure you see a few more that are above 0.6. And in particular, cholinesterase inhibition is also relatively well predicted based on chemical structure as well. The other way to evaluate the performance of your model is something called balanced accuracy, and it's a little more intuitive than AUC. In this case, balanced accuracy is the average of sensitivity and specificity, meaning the average of your ability to predict positive chemicals and the average of your ability to predict true negative chemicals. And it's different from regular accuracy in that balanced accuracy combines both of these measures. And that's important for these unbalanced data sets for the following reason. So if you have 100 chemicals, let's say, and 90% of them or 90 of them are negative, all right, and you build a statistical classification model that predicts all of them negative, all right, so you essentially have a very good specificity, but your sensitivity is essentially zero because you predicted them all negative, so you essentially predicted all the positive chemicals incorrectly. You still have an accuracy of 90%, but your balanced accuracy is essentially 50. So it's the average between 100% specificity and 0% sensitivity. So it's a better reflection for unbalanced data sets like that. And in this case, balanced accuracy was around 0.5 for a significant number of these endpoints, except for potentially rat cholinesterase inhibition. And this was also true for chemical structure as well. So essentially, one of the ways we looked at whether in these in vitro assays were better predicted than chemical structure was by comparing the AUC values. In this case, this is the ratio. This graph is a histogram of the ratio between AUC values for the in vitro assays and the AUC values for chemical structure. And you can see that the majority of these values fall around 0, and this is actually the log ratio, so the ratio is 1, a log of that is actually 0, so the histogram of the average ratio across all these in vivo endpoints. And that was on average around 1, and essentially there was no significant difference or no significant improvement of the in vitro assays over chemical structure as well. We also tried various approaches of combining in vitro assays and chemical structure, but the bottom line is that even combining them, there was no benefit for predicting these in vivo responses by combining chemical structure and in vitro assays. So, as I noted previously in some of the previous publications, they've been proposed to have some benefit of aggregating these in vitro assays based on what genes they're interrogating. So they have 5 or 6 assays that interrogate the activity of the estrogen receptor, and then some of the previous publications have proposed aggregating all those assays that, let's say, interrogate the estrogen receptor into a single summary value, either the average or the minimum, in order to make these in vivo predictions. And essentially we analyzed whether that was actually true in our particular analysis. And in this case, we compared the AUC values for in vitro assays with no aggregation divided by the AUCs for in vitro assays with gene aggregation. And it turns out actually you get worse performance if you aggregate the assays based on genes. There's also been proposed of whether you can aggregate the assays based on gene ontology processes. And if you aggregate them based on gene ontology groups, you actually get no benefit in terms of the statistical performance. Finally, the other thing that we analyzed was the pre-filtering of these in vitro assays. There was a couple publications that have used pre-filtering of these in vitro assays before they did their statistical analysis. And what this means is they actually went through and filtered the in vitro assays for those that provided a benefit to predicting, essentially, or those that were associated, correlated, or with a t-test were associated with the in vivo responses before they even built their statistical models and did their cross-validation. And this is, in the statistical world, this is a big no-no because you are biasing whatever predictive performance you're going to estimate out of your model by pre-filtering that data. And we just demonstrated here what a large number of people in the statistical field already know, that if you pre-filter those assays before you build your statistical model and do your cross-validation, that you can bias the estimates of your predictive performance. And so we just pointed out that that was also a big no-no. So essentially, that analysis actually pointed out that the in vitro assays, as they currently stand in the ToxCast phase 1 assays, as well as chemicals, really don't predict hazard very well based on the currently available data sets. And so one of the things that one of the reasons why this could be is that the current ToxCast assays and the current analysis that we performed on that was based on the nominal concentrations in the well. We all know that the concentrations in the well may not necessarily reflect the concentrations in the blood or in the tissue when you account for dosimetry. There's a lot of things like protein binding, bioavailability, and metabolic clearance that can also have an impact on toxicity. And so maybe one of the reasons why we're not predicting hazard very well is because of these pharmacokinetic factors. And so what we did was did a what's called higher throughput. It's not high throughput, but higher throughput pharmacokinetics. And in this case, we took rat hepatocytes, 4 donor pool of them, and measured hepatic clearance for a subset of 59 chemicals. We also took rat plasma, 55 donor pool of that, and measured how much of the chemical binds to plasma proteins. And together, between hepatic clearance and plasma protein binding, we can combine these two metrics in what's called in vitro to vivo extrapolation models to predict the blood concentration in a rat at steady state. And so we're actually trying to account, at least nominally, for hepatic clearance and plasma protein binding when we're trying to build our prediction models. And this is actually done in a couple different ways. One is in terms of this in vitro extrapolation modeling and trying to predict, account for dosimetry. So essentially what we're taking is those metabolic and binding parameters and predicting blood at concentrations at steady state following a 1 milligram per kilogram per day oral exposure. And this essentially gives us a plasma concentration, as I mentioned, at steady state. We then take the ToxCast AC50 values for a particular assay and then do what's called reverse dosimetry. In that we then take that, since we're at steady state, everything is linear, and then we can do a simple algebraic substitution and say, okay, what is the oral exposure that would give us a blood concentration that's equivalent to this AC50 value in a particular ToxCast assay. So essentially, this is the oral dose required to achieve steady state plasma concentrations that's equivalent to that AC50 value. We did this across all those 500 to 600 ToxCast assays, and then used that information in our statistical modeling effort. So we took our in vitro assays within the AC50 and associated AC50 values, adjusted them for dosimetry, and compared the performance to the in vitro assays with the nominal AC50 values. Okay, and trying to see whether adjusting for dosimetry actually had any benefit on the predictive performance. And counter to our initial hypothesis, it turns out that it doesn't have any benefit, at least with the caveat of how we performed that dosimetry adjustment. And you can see here on the y-axis, this is the AUC values of when these statistical performance metrics in the in vitro assays were adjusted for dosimetry. And on the x-axis, here's the AUC values with the nominal AC50 concentrations. And essentially, drawing a straight line here, you would see drawing a straight line, you would see essentially no increase in statistical performance. And if you do the statistical evaluation of that, the p-value is not statistically significant. So this actually tells us that even for adjusting for dosimetry, these in vitro assays still cannot predict in vivo hazard to any significant extent. But what else can these in vitro assays do, and what else could they be good for? Well, one analysis that we also did was, okay, instead of trying to predict in vivo hazard, could these in vitro assays be used for and be useful for identifying potential molecular initiating events in a mode of action type of framework? And one way we tried to do that was similar to what Richard Judson has proposed in some previous analysis that he has run, and essentially trying to do an enrichment analysis on a 2x2 contingency table analysis, essentially, on these in vitro assays to see if they're significantly enriched in a particular endpoint. And in this particular case, we convert the in vivo animal responses also into these discrete-based positive and negative responses, and we also convert the in vitro assay responses also into a positive and negative response. Essentially, is it positive in an in vitro assay, and is it positive in an in vivo animal response? And essentially, then we're able to calculate an odds ratio based on these 2x2 tables. And on the right-hand side here, you see the log odds ratios for all significant in vitro assay and in vivo endpoint combinations. An example of this is for two in vivo endpoints. Here is for rat cholinesterase inhibition and mouse liver tumors. For rat cholinesterase inhibition, you can see the in vitro assays that have the highest odds ratios and the most significant odds ratios are make biological sense, and these are acetylcholinesterase binding and butyrylcholinesterase binding. So this does make sense from a biological standpoint that these assays have the highest odds ratio for this particular endpoint. Now, it doesn't necessarily mean that the of this kind of analysis versus predicting in vivo hazard is that it doesn't necessarily mean that these chemicals are going to go on to cause cholinesterase inhibition in vivo, but you have an increased odds of if your particular chemical activates these assays in vitro, then you have a significant and higher odds of going on in vivo to that particular effect. This is also true for mouse liver tumors. The highest odds ratio was PPAR alpha reporter activity, and that's been well known and well characterized for playing a role in rodent liver tumors. So you can see that just because a chemical actually activates PPAR alpha receptor doesn't necessarily mean that it's going to go on and become a liver tumor promoter, but you have an increased odds of that particular chemical producing liver tumors. So it's an alternative and a subtle difference in how you view these assays, but it's more biologically consistent with their ability to interrogate these molecular initiating events. So if you take and plug this analysis into our little cartoon here, you can see that currently the ability to take these in vitro assays and predict hazard, we didn't do a very good job at. But if you take these same in vitro assays and examine them in a mode of action-based context and examine them as biologically meaningful molecular initiating events, they can actually inform us of what targets that may be important in this mode of in vivo mode of action. All right, so how do some of these technologies then also evaluate when we're talking about dose response assessment? For this particular analysis, we took our same rat liver metabolism and rat plasma protein binding, take our computational in vitro to in vivo extrapolation models and our in vitro assays, and do our reverse dosimetry to predict the oral dose required to achieve these steady state plasma concentrations. And then we do this across all these 500 ToxCast in vitro assays. And what we're going to do then is get a box plot that spans the most sensitive assay to the least sensitive assay. However, for a risk assessment, one may propose, and on a conservative level, that we want to perform a potential risk assessment on the most sensitive assay. This is a corollary to the way they do it in vivo, in that for an in vivo risk, based on a regular risk assessment, they take the in vivo endpoint, of which that's considered adverse, and do a risk assessment on the most sensitive in vivo response. And so if we take these assays, and even though they may not necessarily be connected to necessarily an in vivo response, what would happen if we took the most sensitive assay and say, okay, how does it align with an LEL value from an in vivo LEL value from ToxRefDB? Can we use essentially these in vitro assays, and the most sensitive assay is that, as a first order conservative estimate of a point of departure for a risk assessment? And we did this on a subset of 59 chemicals from ToxCast phase 1. Well, it turns out that if you plot these in vitro oral equivalent doses for the most sensitive assay with the low effect level, in vivo low effect level, approximately 95% of the time, these in vitro assays are going to be conservative, all right, and on average, they are about 60-fold conservative. So you can see here there's a distribution of the difference between the in vivo LEL and the in vitro oral equivalent dose. So on average, the in vitro assays, the most sensitive in vitro assays, is about 60-fold more sensitive than the in vivo response. So what this suggests is that you could also potentially use these in vitro assays as a conservative first-order approximation of where you're likely to see in vivo effects for a particular chemical. However, another way to do this is to actually use, in addition to these in vitro responses, is to actually perform some in vivo short-term genomic assays. And what I'm going to tell you about is the ability to take these in vivo short-term genomic studies and be able to evaluate them using the same paradigm as been previously used to generate traditional risk assessment values such as the RFD and risk-specific dose. So in the traditional risk assessment paradigm, these subchronic and chronic animal studies are performed to pull out these pathological responses. And these pathological, and obviously they're performed as a function of dose, and then you fit these pathological responses with a variety of statistical models. And then these statistical models are used to identify a point of departure in that dose-response curve. So essentially this point of departure, what's called a benchmark dose, is a dose at which you see an adverse effect beyond that seen in controls. Okay. And then this lower confidence bound of this benchmark dose is then divided by various uncertainty factors, and you get what's called a reference dose, which this reference dose is the dose at which a person can be exposed to over the lifetime without any expectation of adverse effects. For cancer-related endpoints, you divide by a certain factor and get what's called a risk-specific dose. And this risk-specific dose can be anywhere from what dose of a chemical produces a 1 in 100,000 or 1 in a million risk of that particular chemical. Well, instead of these pathological responses, what would happen if you plugged in transcriptional responses? Would essentially you get the same ultimate risk RFD values and risk-specific doses if you evaluated transcriptional perturbation instead of pathological perturbation. So essentially that's what we're trying to evaluate. But instead of performing this transcriptional perturbation, can you plug these transcriptional responses into the same data analysis paradigm where you fit each gene with the same statistical models as which you fit these pathological changes, identify a point of departure, and in this case, instead of going directly to an RFD, we're going to group these genes based on signaling pathway. So we group all the genes, let's say, based on P53 signaling, all the genes based on NF-kappa B signaling, and compare genes, point of departures for each of these pathways with our apical point of departures. Essentially, can do these pathway-based points of departure or benchmark doses correlate with pathological responses? And to do this, we did two different studies. One was a comparison of these apical and transcriptional point of departures following a 90-day exposure. And then we also did a second study to find out whether this relationship between apical and transcriptional points of departure varied as a function of time. In other words, do we have to continue to expose at 90 days, or can we go to shorter and shorter time points to find the same correlation? So essentially, in our first study, we took 5 different chemicals that had been previously tested by the National Toxicology Program. You can see them here. We took the same route of exposure as they did in the original NTP studies. We added doses, but the doses in the NTP studies are underlined here. And then in this particular case, they exposed dichlorobenzene to 0, 300, and 600. We added additional doses so we could more fully characterize the dose response. We also chose the same rodent model as they used in their NTP studies. We exposed them for 90 days, and we did transcriptional measurements on the same target tissue. Let's see. Yep, there it is. And I will point out that we measured apical responses, in this particular case, histological and organ weight changes on the animals in parallel to the gene expression changes in this target tissue. And you can see for each of these chemicals, we evaluated ourselves in our study non-cancer endpoints, and you can see the points of departure that we calculated for each of the chemicals for non-cancer changes, and you can see what the endpoints are. They range anywhere from liver weight changes to pathological changes in the lung from trichloropropane, as well as liver changes and pathological changes in naphthalene. So we got point of departure for non-cancer endpoints. We also took the tumor data from the NTP studies and got points of departure for tumor-based effects. And so when we took those points of departure for the apical responses, we asked a simple question, is that are there pathways, transcriptional pathways, that have points of departure that are highly correlated with those apical responses? And for those that are correlated with the apical responses, do they make biological sense? So these are the cellular pathways with benchmark dose values that correlate with the non-cancer changes in pathology. And you can see the partial correlation coefficients calculated here and their associated p-values. There are a number of them that are have a highly significant correlation with the apical responses. And it turns out that that a significant number of them make biological sense as well. That lung and liver injury following chemical exposure has been known to shift energy metabolism rates. And this lectin complement pathway plays a major role in the clearance of apoptotic cells. And you can imagine that's also important in non-cancer apical responses. And our friend RAS was also highly correlated, and this points out the fact that regenerative cell proliferation is also important in non-cancer effects. So it's one thing to identify these pathways that are correlated with non-cancer effects in the same animals at the same time point. In other words, transcriptional changes are correlating with pathological changes at the same point in time. But it's another thing to say, okay, what are pathways that are correlated with tumor responses 2 years down the road? And so that was the other question that we asked. And you can see that even though we're trying to predict apical responses 2 years down the road, there are a number of pathways that are also significantly correlated with those apical responses. And they also, turns out, make biological sense as well. In this particular case, for this first pathway, this expression of these integrins have been associated with cancer processes, as well as our friend RAS and RO have also been associated with chemically induced lung tumors. And this particular pathway is actually an interesting pathway in that it regulates the translation of proto-oncogenic RNAs. So it's a kind of a novel way to regulate potential chemically induced tumor promotion. And then our old friend VEGF and ERB, which have been known to play a role in tumor formation as well. So a number of these highly correlated pathways also make sense in terms of biological sense in terms of their ability to correlate with these tumor-based points of departure. So the next study was, okay, now we saw these correlations from a 90-day study. Can we run a 5-day study or a 2-week study or a 4-week study and still get this same correlation? So in this particular set of studies, we took 6 chemicals. 3 of them, tribromobenzene, bromobenzene, tetrachlorophenol, produced primarily liver responses, and these are primarily non-cancer liver-based responses. And these were all IRIS chemicals, so essentially these chemicals have full risk assessments on them in the EPA IRIS database. The bromobenzenes and the tetrachlorophenol were all delivered via gavage, and the doses that were performed in original studies on which a risk assessment were based were underlined. So we supplemented them as well. And we switched rodent models, and most of these studies were performed in rats, but were performed in the same models as the risk assessments were performed in. We also measured both pathological responses as well as transcriptional responses at 4 different time points, 5 days, 2 weeks, 4 weeks, and 13 weeks, and we measured these changes in the target tissue. For the bottom 3 chemicals, these chemicals were in the IRIS database for both non-cancer and cancer-related responses. So these 3 have both non-cancer points of departure as well as tumor-based points of departure. And these were primarily feed-based. You can see the doses here were also supplemented from the original risk assessment doses, and these were also rat models. But the target tissues, we chose to diversify the target tissues away from just liver and lung and try to see whether this correlation held with other target tissues such as thyroid and bladder. So we diversified in that way as well. And we measured these apical responses and gene expression at each dose and each time point in the target tissue. So if you take that rather enormous study and compress it down into a few graphs, you can see the relationship between the apical points of departure and the transcriptional points of departure in these 4 graphs. On the y-axis here is the apical point of departure for the most sensitive pathological effect. Okay, and then on the x-axis is the transcriptional point of departure. And instead of identifying, since we have diverse target organs and diverse responses, so instead of trying to identify what pathways were correlated across these different target organs, because you're not necessarily going to have the same pathway in a mode of action that is correlated in thyroid tumors versus liver tumors. We took, instead of these correlated pathways, and took the most sensitive pathway and just asked the question is transcriptional perturbation for the most sensitive pathway also correlated with pathological changes? And if it is correlated, how correlated is it? And you can see in this particular case, for 5 days, we have a correlation of about 0.9. at 5 days, and this correlation stays around 0.9 between 5 days, 2 weeks, 4 weeks, and 13 weeks. So this correlation between the apical pathological changes and the most sensitive, I will emphasize the most sensitive transcriptional points of departure, is pretty stable from 5 days all the way out to 13 weeks. Now, if you take that data and combine it with our first study, so we have a large selection of target organs, bladder, liver, thyroid, lung. We have data from rat and mouse across 2 different species, and look at the apical points of departure correlated with the transcriptional points of departure. It's also correlated at 13 weeks to a very significant extent. If you do that across in the tumor responses from our time course studies, here's 5 days, 2 weeks, 4 weeks, and 13 weeks, you can see that our transcriptional point of departure for the most sensitive pathway is also correlated with our tumor responses as well. And if you combine that with the first study, these transcriptional points of departure for the most sensitive pathway is highly correlated with the tumor responses in 2 years down the road. So you can see these apical responses, pathological responses, are fairly correlated with the transcriptional perturbations in those target tissues. So what it's saying is these technologies can be used for dose response assessment. I'm running out of time, so I'm going to quickly go through this exposure part. But essentially what we're going to do is take our reverse dosimetry model, and instead of doing it in rat liver metabolism and human plasma protein binding, we did it, or in rat plasma protein binding, we did it in human. And we also did in vitro to in vivo extrapolation models for this human metabolism and human plasma protein binding. We did the reverse dosimetry, and we calculated what the oral dose in humans was for each of these ToxCast in vitro assays. And when we did that and compared it to human exposure, we are able to benchmark to say, okay, if we have in vitro, if we have in vitro bioactivity at a particular oral equivalent dose, what are humans exposed to? Is this bioactivity at orders of magnitude above or below what humans are actually exposed to? And it turns out that for about 90% of the chemicals, this in vitro bioactivity occurs at oral equivalent doses. Only about 10% occurs at oral equivalent doses that overlap the most highly exposed subpopulation, suggesting that for 90% of the chemicals, you don't get bioactivity at current existing human exposure levels. All right, but unfortunately, the human exposure estimates are actually pretty rare and hard to come by. In the ToxCast phase 1 chemicals, approximately 80% of the chemicals had exposure estimates, but for the chemicals that are in the ToxCast phase 2 set, less than 10% have exposure estimates, not allowing us to make these assessments of whether bioactivity is getting into the range of human exposure. All right, and it also suggests that these near-field component exposures estimates are going to be required to make these estimates. Near-field meaning things like personal care products and what you're exposed to in indoor air versus what you're exposed to from chemical release into the environment and actually getting into the food chain. So yes, exposure is actually necessary to put these in vitro assays into context because in order to make prioritization decisions, you're going to take chemicals where you have in vitro bioactivity that comes very close to where you have human exposure, and you're going to deprioritize those that have oral doses that are significantly away from any human exposure. But we haven't done a very good job at measuring these human exposure estimates in order to provide that context. So kind of my last summary is how does all this data, what I've always talked to you today about, fit into a data-driven risk assessment and tox testing framework? Well, we know that these in vitro assays don't do a very good job at predicting hazard, but can they still be useful? And we believe that it can be useful in two different ways. One, I showed you that these in vitro assays can be used to identify these molecular initiating events. And so they can be a way to break chemicals into these weak, nonspecific interacting chemicals, as well as these potent specific interacting chemicals, those that activate the estrogen receptor at very low doses. And you can see that if you look at the existing ToxCast data, a significant number of chemicals actually turn out to be weak, nonspecific interacting chemicals. Here's on the x-axis is the AC50 value, the minimum AC50 value across all 500 assays. And you can see that over half of them have over half the chemicals in ToxCast phase 1 have minimum AC50 values that are greater than 1 micromolar. Also, meaning with a nonspecific part of that equation, if you take the minimum AC50 value, the most sensitive assay, and divide it by the lower quartile or even the median AC50 value across all these 500 assays, you can see that a significant number of them activate the minimum, the most sensitive assay at essentially the same dose of which you're activating the median across all those 500 assays. And for comparison, this is BPA, which is a fairly specific estrogen receptor agonist. You can see that ratio between the minimum and the lower quartile in this particular case is it's orders of magnitude different, whereas most chemicals have less than tenfold different between where they're activating the most sensitive assay and where they're activating a significant number of assays. If you take these in vitro assays, and particularly for the weak nonspecific interacting chemicals, you can use that to define a first-order margin of exposure by just taking the most sensitive assay. But for those potent specific interacting chemicals, you can go down a separate route, which is defining a tentative mode of action, and then taking those and comparing it to human exposure. And then asking the question, is that margin of exposure less than a certain value? Meaning, is that margin of exposure greater than 100? And if it is, then fine, we'll stop. If it's less than 100, then maybe I need to define my margin of exposure or define my point of departure to a more precise state. In this case, you could move on to these short-term transcriptomic studies of which you're able to define these points of departure to a much better state. And then ask the same question of, can we define a second-order margin of exposure, and is it greater than a particular value? And so what could that value be? Well, it turns out that if you define a margin of exposure of about 100, you could filter out approximately 40% of your chemicals in that first in vitro assay step, meaning that 40% of the chemicals have a margin of exposure greater than 100 if you used in vitro assays to define that first-order conservative margin of exposure. If you define it at 1,000 and say, I want 1,000-fold different between my most sensitive assay and human exposure, then you would filter out approximately 25% of the chemicals. So finally, how much would that cost? And so my last slide is kind of how much would that cost. And then if you developed a tox testing paradigm using this approach and compared it to the current REACH testing requirements, you could, given these different tiers and the fraction of chemicals, I won't go into that, falling into the different tiers, it would essentially, cost of testing about 10,000 chemicals is about $2 billion, and would cost us about a little over 1 million animals. But if our current, if we apply the same cost and animal cost estimates for the same 10,000 chemicals, that would cost us $5 billion, and we'd use over 4 million animals, suggesting that application of these technologies in this kind of tiered framework has both animal sparing as well as economic benefits as well. And with that, I realize I am out of time, and I'll acknowledge all those that participate. Thank you for sticking with me.
Well, thank you so much for that overview. There is a lot of information packed into this presentation.
Sorry, you kind of had to.
No, it's great. I mean, there's a lot of research going into how we can use these assays. I'm going to ask just generally, if someone has a question, go ahead and speak up. So no one has a question?
I have a question. This is GL Prasad.
Okay.
I had trouble with the audio for the initial part, so I missed this wonderful presentation, part of it. But I do have a very specific question. You talked about looking at transcriptomic profiles with at a subchronic or suboptimal dose versus looking at a dose at a higher dose where you would relate it to the disease endpoints and things like that. Do you think it would be possible to take the same approach in a cell culture system where you don't have a defined endpoint, or maybe you have a defined endpoint, like comparison between cytotoxic doses versus subchronic doses where cells undergo adaptation?
We've done that for a very small number of chemicals. We have a bigger database for in vivo, comparing our in vivo transcriptomic changes versus our in vivo pathological changes. And there we have over a dozen chemicals, and we're continuing to add more. What I believe you're asking, if I'm interpreting your question correctly, is could you take the same approach, treat cells in vitro at concentrations in the media that are equivalent to blood concentrations in vivo, and essentially predict what your point of departure would be for an adverse effect. Is that correct?
That's correct.
Okay. We've done that for about 3 chemicals, and just to see whether it has a chance of working. And it turns out that I wasn't very optimistic going in. I was sort of a pessimist. But it turns out that if you treat primary rat hepatocytes at blood concentrations that are equivalent to in vivo doses, that you can predict reasonably well where your in vivo point of departure is likely to be based on transcriptional changes in those primary hepatocytes. So it is a field that we are pursuing, and did some additional studies to address that fact for a larger number of chemicals in the future. So,
and can I have Can I seek another clarification, please?
Sure.
I see that the presentation is being recorded. Would it be possible to have this audio and then slide deck presentation made available to the attendees?
Oh, definitely. Are you on the ASCCT membership list?
No, I'm not.
Okay, that's fine. Just send me your email, because I don't see the emails of the participants here. So my email is ksullivan@pcrm.org. And
Sullivan at
PCRM.
Okay.
.org, and we can. If I have your email, I can send you a link.
I appreciate that very much.
No problem.
It's very, very informative, but there's a lot of ground that was covered in this presentation.
Anyone else have any further questions? Okay, great. Well, thank you so much for participating, and Dr. Thomas, thank you so much for giving this presentation. We really appreciate it.
You're welcome.
Till next time, everybody. Thank you.
All right. Bye-bye.